I was confused too. Like
No,
what
she
to,
is
yeah.
almost ready
I
for the
also
exam,
got
inshallah.
confused.
Yeah, yeah, yeah. So just go for the
Okay.
and read the scenario, please.
Yes, sir. So the pregnant lady undergoing open cholecystectomy, 34 weeks pregnant lady undergoing cholecystectomy for necrotizing cholecystitis. Her BP is falling, heart rate is low. Patient is in reverse Trendelenburg position. She has been given combined G and epidural, and operation is taking longer duration than expected.
Now tell me the answer of this question number one.
The risk of this patient, benefits and risks. The benefits are that as the patient is pregnant and she is having necrotizing cholecystitis, so we can control the infection. Otherwise, it can lead to septicemia and ultimately septic shock. And as the patient is pregnant, we can prevent the induction of preterm labor. The risk factors are that the surgery is taking a longer duration. There is chances of deep vein thrombosis, and also there are chances of intrauterine fetal death, and preterm labor is also a
Okay.
risk factor.
So who will you involve in the care of this patient?
I will involve my consultant, anesthetist, ITU registrar, neonatologist, obstetrician, and the patient himself.
Where to manage this case post-operatively?
This patient can be managed in obstetric HDU or ITU as per the available.
Okay, suppose this patient is going under the laparoscopic cholecystectomy. So, what is the effects of pneumoperitoneum in this case?
Pneumoperitoneum causes shock, a decrease in the blood pressure, and also decrease in the heart rate, bradycardia, and also can cause abdominal compartment syndrome also.
So, the pneumoperitoneum will lead to the compression of the IVC, correct?
Yes, sir.
It will lead to venous return, decrease cardiac output, okay, and decrease blood, like ultimate decrease cardiac output, and so also the metabolic, also the hypercarbia and acidosis and hypoxia. Remember this, okay? Now, why blood pressure is decreasing in this case?
Because the as the patient is in reverse Trendelenburg position, so there is compression of the IVC by the gravid uterus, which ultimately decreases venous return, hence cardiac output, and also there is a, sepsis from the necrotizing cholecystitis
Very
leading
good.
to shock and sepsis.
Now, how will you increase the blood pressure of the patient?
I will reposition the patient to the lateral side so that the gravid uterus decreases its compression on the IVC.
Also, you will raise the leg of the patient to increase the venous return, correct?
Yes.
Yeah. So now, can you define the preload?
Uh, it is the amount of the myocardial work which has been stretched to the maximum at the end of the diastole,
Okay.
or it is
What?
the end.
Yeah, it's simply, the left ventricular end diastolic volume against which the left ventricle will contract. What is afterload?
Uh, Afterload is the amount is the amount of the pressure against which the heart has to pump blood to the body and the peripherals.
Yeah, to eject the blood, correct? So it's the pressure or resistance of the pressure or resistance against which the heart has to overcome to get the blood ejected from the ventricle. Or okay, now tell me, what will be the body response to decreased blood pressure?
So the body's response will be the activation of the baroreceptors, which will stimulate the sympathetic system and will cause a compensatory tachycardia and increase in the blood pressure by causing the peripheral vascular constriction. Hence, the cardiac output will increase and the cardiac BP will also increase. Otherwise, there is also a autonomic response because of the decreased venous return, which cause yes. Otherwise, there is a, hormonal response which
Okay.
causes release of catecholamines like noradrenaline, and also RAS system, renal angiotensin system, aldosterone system is activated, which leads to the retention of salt and water and ultimately increasing the blood pressure.
Also, the cortisol, correct?
Cortisol, yes, sir.
Yeah. Now, can you define the Frank Starling law?
Uh,
Okay, no problem.
sir,
How does, okay, we will come back to
I
this
can,
question. Okay, how does the
yes.
preload, okay, go ahead, Dr. Sultana, if you know the answer, if anyone know the answer. What is Frank Starling's law? Okay, all right. So we'll come back to this question. How does the preload affect the systemic circulation, Dr. Savlin?
How does preload affects the systemic circulation?
Yeah,
Uh, so preload is the venous return, uh, which affects the cardiac output. So if there is a decreased venous return, it will further cause a decrease in the cardiac output and hence decrease in the blood pressure.
okay, okay. Very good. What are baroreceptors?
These are the mechanoreceptors which are located in the carotid sinus and in the aortic arch. They are sensitive to the changes in the blood pressure and they are supplied by the sinus nerve of Herring, which is a branch of glossopharyngeal nerve.
Okay. Now tell me, what are the factors affecting the venous return?
Factors affecting venous return.
Yeah.
So if there is a vena cava compression, this will lead to the decrease in the venous return. Also, gravity decreases the venous return. Or sometimes there is a muscle contraction of such as in exercising or swimming. They will increase the venous return. Uh, Also, there
Also,
were more also.
the
Two,
circulating blood
three
volume
more.
level, correct?
Okay, sir.
Yeah, and the respiratory cycle.
Okay, sir.
So, how the respiratory cycle? Can you tell me more about this?
So during inspiration, the venous return will increase. Uh, so that's it. That's all I remember.
Yeah, when the venous return is increased, is because of the negative intrathoracic pressure. Okay, so during expiration, the venous return is decreased and is because of the positive intrathoracic pressure. Now tell me about the and also there will be effect of gravity. Okay, and venous
Yes.
tone. Now tell me,
Venous.
can you tell me about the mechanical DVT prophylaxis?
These are TEDs, thromboembolic deterrent agents, or there can be pneumatic compression devices.
Excellent. What can be done to improve the preload of this patient?
We can start by giving IV fluids to the patient and give inotropes or vasopressor agents also. Yes.
Also, we can go for leg raising, manual left shift of the gravity uterus, correct? What you mentioned already. Now tell me
Yes.
the actions of inotropes.
So there are adrenergic agonists, for example, adrenaline, noradrenaline. They cause vasoconstriction, which will further cause increase in the heart rate and will increase the systemic vascular resistance and ultimately causing the cardiac output to increase. On the other hand, we have dopaminic agents like dobutamine, dopamine, which will cause increased contractility of the heart to increase the blood pressure, but they produce vasodilation.
All right. So now, what is the physiological response to standing up?
When we stand up, there is pooling of the blood. Whenever there is pooling of the blood, the venous return will decrease. And we know that BP is a product of venous return and cardiac output. So if the venous return is decreasing, the BP will also increase. So now the BP have decreased, the BP will decrease. So now the BP have decreased, there will be activation of the baroreceptors. So now these baroreceptors will cause vasoconstriction. So once the vasoconstriction has occurred, it will cause increase in the systemic vascular resistance, which will cause reflex tachycardia and hence increase in the blood pressure, which will be normalized because the initial blood pressure was low.
Okay. What is blood pressure?
Uh, It is a product. Blood pressure is a product of systolic volume over the diastolic volume. Sir, I'll come back to this later.
Okay, okay. What are the all right, we will come back to this question. How to prevent DVT?
In a pre-operative patient, to prevent DVT, we will start with we follow ERAS criteria. We'll give them compression stockings, and also if the patient is in procoagulable state, we can start with IV heparin, which will be stopped 12 hours before. And during post-operative period, we will ambulate the patient as soon as possible. And if the patient is not ambulating, we will consider for pneumatic compression devices and TEDs. And if required, we'll keep the patient on prophylactic subcutaneous no molecular weight heparin.
And if the patient is stable, what you will do for the discharge? What medication you will give him on discharge to prevent the
So
DVT?
for DVT, right?
Yeah, yeah.
To prevent low molecular weight subcutaneous heparin,
Wait a minute. We can go for warfarin, correct?
oral warfarin, yes, sir.
Yeah, we
Because
can
that
go
is
for
an
oral warfarin. Yeah, when the acute problem is resolved, we can go for oral warfarin 3 to 6 months. Now, what is the mechanism of action of DVT stalking?
so the mechanism action of DVT stocking is that it causes compression of the vessels, leading to the increased circulation between the superficial and the deep compartments, and there is no stasis in the deep compartment of the
So
vessels.
it improves the venous return, it reduces the cross section of the legs, what you mentioned, and it decreases the amount of blood stresses, correct?
Yes, sir.
Now, about this, what is the blood pressure, or you can say it is the product of cardiac output and systemic vascular resistance. Remember, okay?
Yes.
Now, about this heart rate, cardiac output is the sum of heart rate and its stroke volume, correct? So, what are the
Yes, sir.
factors that is affecting the heart rate?
So the factors affecting the heart rate will be first will be the non-modifiable like age. If the patient is athletic, they will have be having bradycardia, and the other factors affecting the heart rate are ongoing sepsis.
Wait a minute. So, this is age, fitness, hormones, autonomic innervation, correct?
Autonomic innovation.
Yeah.
Yes.
What are the factors affecting the stroke volume?
So the factors affecting the stroke volume are also the four are same: age, fitness, this autonomic nervous system. Apart from that, there are end diastolic volume and also the pulse pressure and
Okay, so you
uh,
mentioned the fitness, contractility of the myocardium, the preload, and the heart rate, correct?
yes.
All right. So we almost covered this station. I think we have a few questions about this Frank Starling law. You said I'll come back to this. So the Frank Starling law, greater the end diastolic volume, greater the stroke volume. All right.
Yes.
So just
yes, sir.
remember, according to the Frank Starling law, whenever there is a
Stretching of the
yeah,
muscle.
whenever there is a increase in end diastolic volume, it will lead to the stretching of the left ventricle, and it will increase the cardiac output.
Output.
So that will lead to greater stroke volume as well.
Okay, sir.
Yeah, but this will be up to certain limit. Okay. Now we have this one questions. All right, we almost covered the whole station. Okay. This was the whole station that we discussed, and